Hello, and welcome to the 103advantage.com and this Health Benefits Webcast, this quarter's informational streaming video, allowing you to connect with Local 103 in the comfort of your own living room, favorite coffee shop, or wherever you may be joining us from tonight. The state of the healthcare industry in America today is in crisis and has been since about 2000. We'll get into the hows and whys during this program, but since 2000, rising healthcare costs have required Local 103 to more than double its hourly contribution. And with that, costs are still outweighing income revenue, and Local 103 is having to dip into its reserves to cover the shortfalls. Here with me tonight to explain some of the necessary changes to the members of Local 103 and their families, business manager Mike Monahan. Mike, welcome.
Thanks, Tom.
Now, this webcast is almost a carbon copy of what happened at the hall last Saturday night, November 5th.
Yeah, well, last Saturday we held a similar forum to discuss those changes. Very well attended, about 800 people showed up, and a lot of great questions, and it was good. I know all the trustees were there and thought it went well as well. Those trustees on the union side, President John Dumas is a trustee, Financial Secretary Chuck Monahan is a trustee, and myself as the business manager. On the employer's side, NECA chapter manager Glenn Kingsbury, Paul Garasino, the owner of JM Electric, and Broadway Electric's designee Jonathan Winslow, the 6 trustees, labor management, and Rich Gambino being the trust fund administrator that administers not just health but pension and deferred income, and oversees the day-to-day operation and is dealing with investment managers and everything else.
So it seems like it's quite a big operation to make this thing happen.
Yeah, I mean overall it's a $1 billion+ operation. Yeah, based on with all the funds combined.
Let's go ahead and get right into it and look at the current benefits per hour, what everybody puts into it, and kind of where things stand currently.
Well, currently we're at a $13 an hour contribution, and for that 8-hour workday, it's hard for some people to fathom, especially when we see the numbers from previous decades. But just over $100 a day, $2,080 per month is what a working journeyman and technician, and for that matter the apprentice, it's the same contribution, goes into the fund. So it's an extremely expensive fund for a Cadillac plan, I think, in its truest definition. We are self-insured, self-administered. We are on Blue Cross's network. Basically, we're still self-insured, self-administered, but we've bought into their network for a small fee. We get a bigger return, of course, than the fee. And that helped save some money for a number of years when we went to them. The plan as it is now, there's no copay at doctor or hospital visits, and prescription drugs are $8 copay, what we consider retail. The mail-away is free currently until December 1, and we'll discuss those changes. And there's no restrictions on whether it be name brand or a generic drug. So that's a very short overview of the plan as it is today.
And I think that, as it just showed on there, that's just medical. Anything non-medical that you guys cover as a part of the plan?
It's a great question. We do. The plan is not just medical. We have dental coverage as part of our plan. And a lot of people don't realize is life insurance is part of this plan as well. There's a $50,000 life insurance plan, $100,000 accidental plan is also part of this overall health insurance plan, health benefit plan. And
who is covered as a part of the plan?
Well, the people that are covered in the plan, of course, are all those who qualify, and those are all the active members, those that have getting contributions made on their behalf. So all your, once the contributions come in, you work 960 hours, you have coverage, and that will change. We'll discuss that later on. So the active person's covered. We cover our unemployed indefinitely, something that we're extremely proud of, and it's not going to change. We have no intentions of changing that, and it's something that all the trustees are proud of, and really what separates us from many in the building trades and IBEW. Our retirees at age 58 is the normal age of retirement, and that's a pension issue. But when you retire, if you qualified, meaning you're in the plan 10 years prior to retirement, you have full health coverage as the active, as the unemployed, just like everyone else. So that's a great benefit as well. Age 65 and over, age 65, you become Medicare covered. We cover the 65 and above. Medicare is the primary, we're secondary, and we have prescription drugs as part of that as well. And another part of that, the member passes away, the spouse receives 5 years of coverage following the death of the member.
And you know, having talked about the medical and non-medical coverage, there are some changes coming December 1st of this year, and we're going to outline some of those here over the next couple minutes. What's the first big change that you see coming to the plan?
Well, the first one is the doctor's visit, and currently right now it's something you have to sometimes argue with the receptionist that we don't have a copay. It's so unheard of that you know, they don't believe you. You're just trying to get out the door. So there's no copay currently at the hospital or the doctor. The change is there's going to be a $20 copay at the doctor. But it's important to point out, as the trustees, we talked about it, we don't want people not to get their physicals. We don't want a woman not to go for mammograms and, and GYN and so on and so forth. And of course, babies, all those well visits, we don't want them not to go and get those. So those do not apply. Mm-hmm. It's a $20 copay. You feel the need to call the doctor and go to the doctor's office. Vision and dental also, it does not apply. Sure. So that's going to be the big change, is the $20. But it's not on maintenance, so to speak, and the doctor codes it that way.
And as far as prescription drugs are concerned, what are the changes there, Mike?
Yeah, this is also a big change. Prescription drugs currently is an $8 copay. You go to whatever the place of business, whether it's a CVS or a Walgreens or what the case might be, and it's currently an $8 copay. So the $8 copay is what we pay now. If you use the mail away, it's a if you use the mail away, it's free on 90 days. The change is going to be $15 for a generic drug, $25 for a name brand drug at the CVS, the Walgreens. The mail order is still an option, and we still want to continue to push people towards that. And rather than being $0, it's going to be $15 for the 90-day supply and $25 for the name brand. And the savings to the fund, about $2,036,000. We're looking at it and trying to make the least amount of changes, of course, where we can raise as much revenue as possible with the less impact to those in the plan.
And as far as emergency room visits goes, we had talked about just the $20 office visit, but emergency room, there are some changes there, and there's going to be a copayment there as well.
There is, yeah. There's an emergency room copayment. You know, Tom, just before, I'm going to back up a little bit on the mail away. Sure. On the mail away, if you are on a prescription and it's one that you take every day, and starting December 1, you choose you don't want to use the mail away. You go to your CVS and you're going to be able to fill it. You're going to have to pay accordingly, of course, with the changes. On the second refill, you'll be the same will apply, but you will not be able to have that third. Now we know in the beginning people are going to maybe forget and they didn't read their mail or watch the webcast. So the Health and Welfare Office, of course, is going to waive it, but they're not going to waive it more than once, I would say. They're going to say, we're going to push people towards the mandatory mail on those people that use prescriptions every day, every day of the week. So the savings is so much that we felt the need to make it not an option. Because we find people that the mail away is free now, but people will still pay the $8 a month, and they look at it as $25, $24 over the course of 3 months is not enough to push them towards the doing the mail away. Maybe they just, they don't want to use the computer or just don't want to deal with it. So and of course that's their prerogative if they want to pay the $24 when they can get it for free before December 1. Sure. But when you look at the savings the fund can get, if that person was made to do the mail away, it's considerable. Yeah. So we had to make it mandatory, unfortunately, because the savings is so much.
And that's, that's the point of this, is just making sure, and we'll get into slides later, but just making sure we can stem the tide and, see the problems ahead of us and figure out what you can do now to, have health plans in the future.
Right, right. With respect to the emergency room, that, of course, we had the, the doctor copay change. The hospital has some significant changes. We do find, unfortunately, people using the emergency room as their doctor. And so we've looked at the savings, and we're going to institute December 1 that $100 emergency room usage. Of course, if you get admitted, that's waived, but it's not free. As you can see there, it's $200 if you get admitted, and outpatient as well as $200. So it's a $700,000 savings to the fund, and then the $200 portion on inpatient, outpatient is almost $1 million savings. So it was significant enough that we had to, as we discussed, make these changes.
Sure. And if we're talking about emergency room visits and prescription drugs and prescriptions these days with what's on television and what people see, and a lot of the ads today for medical coverage is prescription drug based, and that has a significant impact on the plan, even though that most people don't think prescriptions really do add up to that much.
Yeah. Prescriptions about 20% of the cost of the total overall fund. 50% of Local 103's prescriptions were name brand. So although that is a very high usage, we can do better. And that 50% is attributing to 85% of the overall costs, and 179,013 prescriptions written in 2010, and the total cost is $16,887,269. That's the cost, Local 103's cost for prescription drugs.
And of those name brands, any top prescriptions that you guys have written in terms of, or have seen people filling prescriptions for?
Well, certainly, with the change in the law allowing prescription drug companies and others to advertise on TV, going back, it certainly has had an impact, and that's why they do it. We've followed that trend, and when they were allowed to start advertising on TV, the prescription drug usage has gone up steadily. The top prescription drug for our plan is Lipitor, about 4,316 prescriptions written. The cost, $1,089,467, and the average cost for Lipitor is about $252. Now, when you take that drug alone and say, of the $13, what part of that is for Lipitor? 20 cents an hour of the 13 goes just for Lipitor. Nexium, as you can see in the screen, $361 per prescription, $592,000 plus, and that's 11 cents an hour to the fund. In the Advair, $342 per prescription, $364,000 plus, and 7 cents an hour. So these are the top three. And we're working on wellness. We know the Lipitor, with some education, we should be able to knock that down a little bit.
Shifting gears a little bit in terms of from actual what is affecting the plan to maybe whom is affecting the plan. And research would suggest in the United States today that a majority of the bankruptcies that you see are medical related, just because the spiraling costs, people can't sustain them, and those folks who fall victim to that would be the retirees, just because they're not working. And I don't think I have to explain that, but at Local 103 you guys cover your retirees, and it's a pretty darn good plan comparatively speaking.
Yeah, I mean, it's a great plan. Compared to others, it's an incredibly great plan. Yeah, you're absolutely right. The many plans, the way that they're written, they'll only cover 80%, and the additional 20% on some of these is enough to push you into bankruptcy. That's not the case here. The changes that we're making are across the board, whether it's no percentage of the bill are you responsible for, like many plans. But yes, we cover the retiree, as I mentioned, the pre-65. That's a non-Medicare retiree. We cover that person from 58 to 65. So there is going to be a charge for that retiree. It's going to be a $300. It's going to be a $300 monthly payment for that retiree, and that's going to come out of their pension check. So it's not as if they're going to have to write a check to Local 103. That'll be deducted after taxes right out of their pension check. So that alone is a $1,213,000 savings to the fund. The Medicare retiree, that's 65 plus, they're going to be responsible for $150 a month, and it's a $1,223,000 savings. And you'll see on the screen there, retired prior to March 1, they'll be $50. The reason for the difference, our pension multiplier went up March 1, 1996. It's gone up many times since then. But the retiree the day before versus the March 1, there was a change in the multiplier, and it equals out actually pretty much the same. The fund savings there is $177,000. And another change, a spouse, I guess that would be a marriage after retirement, that spouse cannot be added to the plan.
Okay. And hours worked, I mean, that's something you guys are changing in terms of getting into the qualification. I mean, and it's like 125 hours per month right now, increasing to 144. And, you know, that's going to change for working folks, but, you know, going back to the retirement folks with 10 years of continuous eligibility, that's how they become eligible, correct?
Yeah, it's a big change for some. There's not a lot of people that are going to be affected by that change, but the ones that are affected, certainly they're upset about it, and we can understand it. So there's going to be a change in the minimum hours, but with that, the eligibility, currently now age 58, as I mentioned, you can retire. If you've been in the plan 10 years, you retire with health care. It's a great plan. It's a great benefit. The change here is you can still retire at age 58. There's been no change in the pension. It's still 58. But if you were to retire at 58 with health care, you have to be in the plan 15 continuous years and had to have worked 15,000 hours in the plan. And it's $1.5 million savings according to the actuaries. So that's a big change. We have some people that left the business and they had a break in the sense of their health, not pension. People normally refer to breaks as a pension. But this was a break, meaning they were out of the plan, came back in, get covered to the plan, ready to retire at age 58, 59, 60, but they don't have the 15,000 hours or the 15 years December 1. So it is a big change for some.
And the hours worked is another change. I just mentioned it a few minutes ago before we finished up on the retirement. But that's going to change as well.
Yes, 125 hours now is what the minimum amount of hours the contractor has to report for you to have coverage. So, you know, that allows for many things. But the piece that we pointed out Saturday, there were a few questions around this. The plan, the way that it's written, you're given a month off a year. So you're a fully employed person, and you decide you're going to take a week or you're going to take a couple of weeks off or whatever the case might be. And it totals a month. From, you know, a little bit every month. You are not going to be given a bill. When that month is used up and the employer reports currently now 124 hours, then basically you're made to make up the difference of that 1 hour. The change is going to be 144 hours now. So some people ask the questions in some months where, you take this month, for instance, you get Thanksgiving, you get Veterans Day. There's certain months that have some extra holidays, and combine that with some snow or some cold, and it's possible that you could get down to that 144 or less. So if the contractor's reporting 143 hours December 1st, does that mean you're going to get billed an hour? No. You have to use up that month first. Gotcha. Before this to take place. Okay. And it's going to, it will cut down on some furloughing and so on and so forth,
Yeah. We've reached the halfway point of our webcasts here tonight. Definitely some time well spent so far, but please don't go anywhere. We'll be back in about 120 seconds after these new commercials that have been running in Boston about IBEW Local 103, and we'll be back after that to finish this thing up.
Great.
Okay. They travel to the ends of the earth in honor of the American mission. For too many, when they come home to the land they love, their battles are far from over. Illness and lack of opportunity becomes the new enemy. That's why IBEW Local 103 continually supports and hosts Project Stand Down, a national program providing care and assistance to veterans in need. Let us all take care of the brave men and women who have taken care of us. For more, click Project Stand Down on the 103advantage.com.
IBEW Local 103 electricians and technicians power our city, help us communicate, and convert nature into energy. But our impressive skills don't stop there.
Local 103 is partnering with Wentworth Institute of Technology. And when their members have completed their studies, they will have earned an associate degree in engineering technology.
IBEW Local 103, the best electricians and technicians in the world.
With a college degree in their tool belt.
Click Wentworth on the 103advantage.com. IBEW Local 103, Boston's leading renewable energy professionals, are proving it once again with the newest green technology hitting the Commonwealth, electric vehicles. Our electricians and technicians are certified charging station installers. See for yourself. Stop by our offices for a quick, no-charge charge, and we'll explain what we can offer. Think IBEW Local 103 for electric vehicle charging stations. Visit us online at the103advantage.com. Welcome back. Thank you for sticking around. Mike Monahan, Business Manager, back here for the second half of our webcast. One thing that we did not mention or did not touch on here in the first half of our segment here was the savings related to MRIs when people get those. Go ahead and touch on that.
Yeah, it's another big piece. Of course, all the trustees have been looking at the fund, how we can save money. Not as much as Rich Gambino. I mean, he just buries himself in as we're paying bills, compares them to other bills, and obviously came back with a lot of great ideas on how we can save money. So MRIs was a piece that I don't want to say got biased, but when we drilled into it, there's an awful lot of savings to the fund here with this change. So unless you've been through it, unless you've had a PET scan or a CT scan, etc., it's all imaging. And it's a big cost. I mean, the difference between the freestanding and the hospital is huge. So it's a $200 copay now if you choose to use the hospital MRI. So you go to the doctor, you're complaining about something. It's a business today as much as it is about medicine. And they're very quick, especially when they see our plan and there's no copay. And they got a brand new MRI machine in the building, they may suggest that they want an MRI. What do you know? So they tell you to follow the red line, and you got an appointment next week for an MRI. So you just go through it, of course, and you get the MRI done. In the cases where people, maybe the hospital didn't have it or they couldn't get an appointment quick enough, when the bill came back from the hospital versus the freestanding, I'll use Shields, it's no endorsement, but I think most people are familiar with that name, the cost is about half. And it's going to save the fund about $440,000. So there's no copay at the freestanding MRI facility. If you choose to use the hospital one, then yes, there is. It's a $200 copay. Now, sometimes you have no choice. You've been admitted to the hospital, rushed to the hospital, whatever. There's not an additional cost. That $200, unfortunately, that we've had to institute will cover that. So this is it's a big savings, and we want to push people to, and when the doctor says he wants an MRI and go downstairs, they're going to say, well, can you just tell me what you want? I'm going to go to the freestanding one, and it's going to save the fund a lot of money. So that is a big change.
And it's, the changes that we've talked about, and the additional copays and the MRI scan and the like. No one likes to pay those if they're not used to it. But at the end of the day, it's making sure, as we talked about and continue, Will, in this second half, making sure that the fund is as healthy as it can be in the long run.
Right.
And I think that's the basis of it.
That's the goal, yeah.
And $13 an hour towards that currently. I mean, where does that historically compare to where it was 30 years ago?
Yeah, well, we've looked at this too, and it's frustrating. The medical industry, it's spiraling out of control. It doesn't seem like anybody can control costs. Of course, you're sick, you're injured. It's not something that you shop around for prices, and it's something that you don't skimp on when it comes to getting treated. But we've looked at this, we've drilled into it. And you've used that comparison. When you go back to 1970, the percent, so the contribution, the health and welfare contribution, when you compare that to the journeyman's rate of pay, the contribution was only 4%. And it steadily has increased to 2000, where it was 16%. And it's important for those members and those families that certainly understand the construction cycles. Many remember the 90s. It was a decade of tough times. And when we look at 1990 to 2000, we were able pretty much to hold. I know it says $2.50 there, but shortly after that, it went to $5 an hour, and it was $5 from 1990 all the way up to 2000. From 2000, we've gone from that $5 to $13 in 2011. So it's just spiraling out of control. And from the 4% in 70 to the 11% in 1990 to the 16% 10 years later, and 10 years later we're at 31%. And it's out of control. And I don't see anything in the horizon that is going to be able to control these costs. If we were going to meet the cost on the hourly wage contribution, we would have to increase our hourly contribution from the $13 to $19.68. And at that point, it's going to represent 47%. And you think about from 3% in 1960 to 4% in 1970 to having 47% comparison for your contribution versus the journeyman and the technicians. Well, this is based on the journeyman's hourly rate, but it's 47%. It's not sustainable.
And if you think about it, probably too, if you draw comparisons to any kind of consumer product, be it eggs or milk or gas. We did a little bit of research, and today gas is anywhere from $3.50 a gallon, depending on where you live.
What state?
What state you live in. Back when the journeyman's rate in the 70s was $7, and gas was 36 cents a gallon. Now, if you fast forward to $3.50, that's as a percentage of the journeyman's rate, not as a percentage of gas per gallon increase, but it's still, it's around 8.5%, $3.50, $41.89. The math works out to about 8 percentage points there.
Right.
But what the correlation we're making is that nothing, be it gas, groceries, eggs, has exceedingly gone up as much as healthcare has. And it's, like you said, it's unsustainable.
Yeah, it's not. It's, we understand things go up,
yeah.
as wages do. And that's why wages go up. They're supposed to meet the cost increases of whatever that is. And that's why you ask for raises and cost of living and so on and so forth. But when you look at healthcare, like you said, and the contribution for health and welfare at 4%, and I think it was 5% for a gallon of gas, and it's 8% today, but we're at 31% and looking at 47% if you were going to put this take it out of the raises out of this contract that we just had, I mean, gas would be whatever it is. It'd be, a few $100s to fill your tank. And that's the comparison. It's out of control.
And you can't, people can't certainly feed their family with their benefits.
Well, that's where we're at, and that's why some of the changes, and I do feel strongly about it. I mean, none of the trustees are comfortable or feel good about this. But, $13 an hour, 31%, the comparison, I think it has to stop there, and we have to look at other ways, whether it be the MRI, the co-pays, the retirees paying. I feel horrible about it. But the apprentice, the journeyman wireman, the technicians, you can't eat your pension, you can't eat your health care, and they need money, they need cash. And when you do the math, whether it's rent or a mortgage and a couple of cars and insurance and gas and oil, and a pizza with the kids and soccer, it doesn't add up. And so we have to look at other places. We can't just keep taking future raises and keep putting them towards health care. It's just some of that money has got to get back into the pockets, to ease that pain and to a little quality of life, hopefully for the the majority of active members. Especially
when it's a difference so glaringly. I mean, 43% difference between what it was in 1970, 4% to 47%. I mean, that's 43% of the wage going to healthcare. It's just more going to healthcare these days. I mean, if you just look back, no one would accept that at any time.
Right.
If you guys didn't make any changes, and you didn't have the foresight, and you didn't make these tough decisions today to survive tomorrow, what would happen to the fund?
Well, December 1 is the beginning of the year. So when you see on the graphs, you see 2012, that is December 1, 2011.
Okay.
So plan year 2012 is the end of the month. If we did nothing, I think you can see the income is the $13 times the what we're at now, about 5.8 million hours. The reason you see that bumping up a little bit is finally, thank God, work is picking up, and that's the projections. Those are very conservative numbers. So you can see if we did nothing, costs, that blue line, spiraling out of control. Income is flat with a little bump up, and we have to take out a reserve. So we got about $78 million coming in. You've got mid-90s going out. And by 2015, you're over $125 million going out for health insurance, and about 80, if we did nothing, 80 coming in. So there's the difference which drives your reserves right into the ground. And in 3 plan years, you're looking at, you're broke.
And
you're broke if nothing is done.
What does the situation look like with your changes that will go into effect?
Well, the changes I want to say, some say it does save the plan, and I agree. So I don't mean it literally, it doesn't save the plan. But the changes that we make, the increase in hours, the cost controls that we're looking at, in 2015, with the changes, we'll have about $42 million in reserves, still not your annual costs. I mean, the rule of thumb is to have in reserves equal to your annual costs. So, 2015, you can see where we're under the $120 million. You're about, I think, about $115 million in costs versus the $125 million or so. So the revenue will be the same because I really am serious about keeping it at the $13 an hour. And those future increments out of this contract, which is a 5-year contract, $7.50 over the next 5 years, as much of that as possible I want to get into the pockets of the hourly wage person because they need it. They need it desperately. Things continue to go up, and it just doesn't work. For a middle class family, and today I guess middle class depends on how you define it. That's still both at the house working, passing each other at the front door, dropping kids off and other people picking them up, and I mean it's chaotic out there. So Certainly this isn't going to solve all the problems, but it's going to put more money back into the hourly rate and hopefully ease some of that chaos, so to speak. And so it does save the plan in the sense we're not going broke, but it doesn't solve all our problems.
Would an uptick in jobs help?
Yeah, certainly. I mean, I don't think we're having this conversation if the economy wasn't what it was. The stimulus, the original stimulus bill was used, in my opinion, used like I thought it was going to be used on infrastructure, etc. The current jobs bill stalled in D.C. Will do, I think, what the original one was supposed to do.
Right.
But yeah, we're not having this conversation today if we were in a different economy. The hours that we would get with those people working more than offsets our problem. But we can't just hope that the hours are going to pick up. I think they will, but we have to make the necessary changes now and we just can't wait any longer for the economy to pick up.
As a percentage, where do most of these costs come from? Is it medical? Is it prescription coverage? Is it dental? It seems to me that most people say that medical would kind of lead the charge there, and what are most the culprit for the high costs?
Yeah, medical clearly is the biggest cost here. The dental, the eyeglasses, they've gone, they've had modest increases, but relatively small. The medical, as you can see there, is just spiraling out of control. Prescription drugs, as much as people complain about them, they're a big cost, but they don't have the spiking effect as the medical does.
Mm-hmm. And if you're going to talk about the fund still covering the unemployed, that's not going to change.
No.
And that's a highlight of your plan for the unemployed folks, and rightfully so. But what is the breakdown of the whole fund in terms of contributions? How much goes where, from a percentage basis?
Yeah, I mean, the majority, as we discussed, is medical and prescription drugs and the dental piece as well, But I think it's on the pie chart, are you referring to?
I think it's covering the unemployed and, $4.32 an hour. The retirees make up, 28% of that, if we're going to talk about that before we get to the pie.
Yeah, certainly. Well, as you mentioned, covering the unemployed is something that we have not seen anywhere. Nowhere can you be temporarily unemployed, which today you have to check, I guess, the definition of temporary in this economy. It's horrible. Mm-hmm. Building trades across the country experiencing 30% unemployment. In the unionized sector, the non-unionized sector, 65% unemployment. So this is a different economy, as everyone knows. So the $13 an hour contribution right now, the $2,080 per month that person is contributing to cover the unemployed person in Local 103 is $4.32. That's what $4.32 out of the $13, or 33%, goes to covering the unemployed. We're proud of that fact, also proud of the covering the retiree, and we're still going to cover the retiree. It's just with the copay or the monthly the contribution, so to speak. But the covering the retiree, the $3.62 combined, when you break it out, it's $1.86 under 65, and 65 over is $1.76. Combine them all, it's $7.94 of the $13 is for these three groups, or 61% of the $13 goes to covering the unemployed pre and post 65.
Mm-hmm. And moving on to the pies that you talked about just a second ago, to give a little bit more of a visual representation of kind of where that's going in terms of medical prescriptions and dental vision, maybe just a different representation there, if we can pull up that slide and talk about that a little.
Yeah, it's a duplicate of the graph that we saw earlier, but 70% goes for medical, 21% going to prescription drugs, and the 9% is for the dental, the vision, the life insurance that we mentioned, and so on and so forth. So that's the breakdown of where the money goes annually. And
the following pie then talks about the member groups, the retirees, the unemployed, the working members.
Yeah, the working member, and of course from one day to the next, that can change. But when you take it on a whole, the spending, 43% of the annual spending is for the working member, 32% of the total cost is for the unemployed, and 25% of the total cost is to cover the retiree. That's the breakdown.
And breaking it down even further, this next slide will show us a pretty alarming statistic that says about 20% of the members' claims equal 80% of the cost of the fund.
Yeah, this is, I mean, it's nobody, of course, wishes they were one of the 20%,
Right.
of course. And unfortunately, those 20%, obviously some traumatic injuries and sicknesses and illnesses, and but yeah, so I mean, when you break that out that way, yeah, 20% of the members use 80% of the money.
Yeah. And those folks, we're not saying here on this program at all that they that's something that they're wishing for, or I mean, God forbid, they're not wanting to use that, but that's just what the statistics show.
Yeah, I mean, the reason I put that in there is because we have a lot of smart people, and they do the math, and they say, where the heck is this money going? I think I had another stat there, and it was 30 people in the fund used $10 million. So I mean, those are serious injuries and illnesses and so on and so forth. But you can see, a small amount of people can really use an awful lot of money.
Mm-hmm. Mike, this is the second industry webcast that we've done. We did one about the same time this time last year when talking about the prospects of the new healthcare law that since President Obama has signed. The things that we've talked about on this program are just your individual plans, the things you need to do as a trustee group for the plan to stem the tide, to make sure that the reserves are still there, changes that need to be made now. But relative to the new healthcare law, there are a few changes and stipulations that are required in addition to what we've already talked about here today.
Yes, I mean, of course, we know March 2010, the President signed that into law. It expanded coverage to 32 million Americans. That's a good thing, but it did come with some costs. December 2010, as I mentioned, December 1 is the beginning of our plan year. So the plan year that we're in now, last year, December 1, the changes that happened with us was the no lifetime annual limits, no caps. Nobody ever hit it anyway, but we did have a $2 million annual cap. And if people hit it, we as trustees, of course, we would change it. But we had the $2 million cap. That's waived. That's gone now because of the law. And the other piece that started last year, we always covered, of course, the children of those under the plan. But at age 18, if you weren't a full-time student, you would be dropped off the plan. So full-time students were covered, and you had to send in the proper documentation, etc. The change in the law was 26 and under. So, I mean, many people have their opinion of this, but a 26-year-old child, in my opinion, they're always a child, but they're far from a child. They're an adult. They are now under the parent's coverage, if the parent has coverage in Local 103. So yeah, it was a cost. It's not our problems, that's for sure. But certainly it was a cost added to our plan.
It gained 8 years, more coverage.
Yeah, for the non-college student. Yeah.
So that's going to be there. Another one of the things, December of 2011, there's another stipulation made under the healthcare law that you'd like to talk about. Yeah,
well, December 2011, once again, December 1 coming up will be 2011. It will be plan year 2012. So what triggers 2011 is the mental health parity, and then a couple of years later, there'll be no waiting periods. Earlier on, I mentioned you had to work 968 hours to get into the plan. That won't be the fact in 2013. So once contributions come in, you'll have coverage. One
of the final things we're going to talk about here, wages, and comparatively you know, based on other construction unions,
Yeah.
what your wages are, and then you know where you stack, and then where the total package represents. And as we bring up these figures here, you know, most people think if they're not within Local 103 that, you know, a package of more than $74 an hour, they think, oh my goodness, I mean, you know, that's a lot of money. But in fact, I mean, it goes much, much deeper than that.
Yeah, well, that's total package. I think when you asked the average person what they make an hour, they would tell you what they make an hour. And that's a true statement. What they never really figure in is what's the cost for health insurance, what's the cost for maybe a 401k and pension and et cetera. So yeah, that is $74.36 total package. That's wages and benefits and JTC and other things. And we are the most expensive total package trade. Why I included this graph for when we ratified our contract, and I used it Saturday. We are the highest in total package, but we're the 5th in hourly wage. And I think that speaks towards how much of our money has been going from raises, has been going to benefits versus into the hourly wage. So as I mentioned, we have to control costs, but we can no longer continue to just take raises and put them into the hourly contribution. The hourly wage has got to go up.
Mike, that ends the program in terms of content that we had pre-prepared. Any final thoughts that you would like to make? Certainly a comprehensive look at Local 103's health care situation and what you guys are planning to do in the future. But just any final thoughts before we sign off here?
Well, you know, I'd like to just, I guess, for myself and the other trustees, we're not happy about this. I mean, it's certainly a big change, but with the current economic conditions out there, the economy still flat, construction being hit. You know, it's a blue-collar depression for the construction industry. We don't feel happy about these, but they were necessary changes. We couldn't continue to put it on the hourly wage and look towards other areas that can maybe make up some of the shortfalls. And we're not taking the approach that other plans do. It's important to point out that, yeah, if you use the emergency room a lot, you're going to pay that $200. But the difference with our plan also is we don't penalize. We do penalize now with the copay, but we don't penalize where we're going to cover 80% and you're responsible for the 20%. Many professionals say you should take the model of the car industry or the insurance industry.
Sure.
And we're not doing that. We're in this together. Just because you're unfortunate, and to use the car as the example, you've gotten in 3 accidents last year. You know, because you were genetic, you know, you're born with a certain disease or whatever the case might be. In the car industry model, your car insurance would be more. So you'd pay $17 an hour. I didn't use it because I'm lucky in the sense of my health and maybe how I take care of myself. Mine would be $9. That's the way the car industry model works. We're not doing that. Everyone still pays the same hourly wage. We're all going to say, you know, the same co-pays and so on and so forth. But yes, if you use it more, there is going to be a nominal fee that you're going to pay more than someone that doesn't go to the emergency room or doesn't have surgery. And no one's praying for surgery. But there's a little change, but we still think that overall we're in this together and we'll get through it together.
Mike, thank you for your time today. Thank you for your research and all your time, all the trustees that they put into this program here tonight. Thank you to everybody out there who took the time to watch this program. I think you'll join me in thanking them and say that we'll see them next time with another industry webcast here on the 103advantage.com.
Yep. Thanks, Don.
Good night.